Understanding hypoglycemia and hyperglycemia. People with diabetes can experience hypo and hyperglycemia. This video will help both people who have diabetes and their friends and family members recognize the symptoms so that they know how to help. You will learn the signs and symptoms of hypo and hyperglycemia, treatments for both that you can perform, when to call the doctor if either problem persists, and behaviors to prevent both. What is hypoglycemia? Hypoglycemia is when your blood glucose is below 70 milligrams per deciliter. When this happens, you need to treat it right away because low blood glucose can cause a medical emergency. You can pass out. There are signs and symptoms of hypoglycemia, and they include irregular heart rhythm, either palpitations or fast heartbeat, feeling nervous or anxious, shakiness, dizziness, sweating, blurry vision, feeling weak and tired, feeling hungry even when you've already had a meal, being unusually pale, having headaches, and/or having seizures. If you have one or more of these symptoms, check your blood glucose right away. If it is below 70 milligrams per deciliter, you can treat yourself using the 15-15 rule. This means you should eat or drink 15 grams of quick-acting carbohydrates, such as juice or hard candy, to raise blood glucose and check after 15 minutes. If it is still below 70 milligrams per deciliter, have another 15 gram serving and check again 15 minutes later. 15 grams is equivalent to 1 tablespoon of sugar. You can get 15 grams of carbs by eating 1 tablespoon of sugar or honey, or drinking 4 ounces of regular juice or regular soda, no sugar-free, or eating 3 to 5 pieces of hard candy, or eating 3 to 4 glucose tablets. Glucose tablets can be purchased at pharmacies like Walgreens, CVS, or the grocery store. Check the diabetes area. If your glucose, or sugar, is below 50 milligrams per deciliter, drink 8 ounces of regular, not diet, not sugar-free, regular juice, or regular soda. If you have repeated the 15-15 rule 3 times and your glucose has not improved, you should call a doctor. What is hyperglycemia? Hyperglycemia happens when your blood glucose is higher than your glucose level goal. When you are experiencing hyperglycemia, your body has too little insulin, or your body can't use insulin properly. Glucose targets higher than 130 milligrams per deciliter fasting, Fasting is when you haven't eaten or drank overnight, or haven't eaten for 8 to 12 hours. That doesn't include water. And higher than 180 milligrams per deciliter 2 hours after eating a meal. There are signs and symptoms of hyperglycemia. They include frequent urination, thirsty, even when drinking fluids regularly, blurry vision, tired or sleeping a lot, numb or tingling hands and feet, wounds that won't heal, vaginal infections, sudden weight loss, or hungry all the time. If you have one or more of these symptoms, you need to immediately check your blood glucose levels. If your glucose is not at the level recommended by your doctor and less than 240 milligrams per deciliter, you can lower it by drinking water and doing some light exercise, like walking. But if your glucose is above 240 milligrams per deciliter, avoid doing exercise until your blood sugars come down, because it may worsen if you do physical activity. If you experience recurrent hyperglycemia, see a doctor sooner rather than later to adjust the medications. Don't wait until your next scheduled visit. It is important that you recognize when you have hypo or hyperglycemia and that you know how to treat it. Glucose monitoring is essential for diagnosis and treatment of hyper and hypoglycemia. And exercise is key to maintain glucose levels on target and prevent complications. The next video will talk about how you can use exercise and nutrition to manage diabetes.